Previously, research at the Janeway was done out of individual physicians' offices, but essentially it was all over the hospital. Now we've brought all those activities together into one area. A lot of the projects have similar components, and we've been able to kind of leverage our expertise in doing research by having a centre that everyone's together and collaborate much more easily. A few of the advantages of the area we have is that there's a biomedical room where blood samples and other biological samples involved in research can be analyzed independent of the hospital. There's a clinic room which allows some of the patients involved in research to come to get assessments that will be used in furthering the research. There's a number of meeting rooms around.
Well, considering how many Newfoundlanders certainly live out west. Mm-hmm.
There's a really close connection between Memorial and the Janeway Hospital and Eastern Health. A lot of the residents who are going to medical school will also be conducting research here. There's rooms that are available for the medical residents who are doing their medical training. And these are all the things that came with this new centre that will hopefully contribute to us having a greater impact on the children's health across the province. A lot of the areas of child research are national projects or multinational projects. Having this presence that the new research centre has given us allows us, one, to collaborate better, but also makes it more competitive for us in terms of looking at national and international funding for child research that'll benefit the children here in our province. One of the important reasons for doing health research here in our province is that there are a number of unique things about our children population. In particular, it's often mentioned that we have a unique genetic makeup and that there's certain genetic disorders that we have a higher prevalence of. And it's important to have that local clinical scientist expertise here that are studying these problems, because without that, when larger national studies are done, we miss that unique perspective that is important to our province and our patients. There's currently at least 50 research projects I'm aware of here at the Janeway, and they deal with a full range of childhood diseases. So all of those areas have been brought together here in the new research unit. It's brought what we've already been doing before together and allows us to move forward as a centralized group.